Hello guys, so today we will be talking about a condition where patient can present with complaint of redness of eye and with some kind of mass-like feature in the eye. And we had a young lady in our clinic who came with complaining of she had this mass-like reddish kind of bleeding redness in her eye since long time ago. She can't remember when it did start, but she felt like it has increased in it has progressed recently, and it is increasing. So on examination you can see this reddish bluish hue with mass, multilobulated mass in basically covering around 50 to 60% of the eye, and we can see it's most in the inferior side. And this kind of patient, when you see, we have to suspect because there is a malformation in the congenital area, that's episcleral area. And what we have to suspect is that there can be orbital venous malformations, orbital varices. And this patient, typically she was complaining of increase in swelling when she was bending down. So I asked her to do a Valsalva maneuver, but it didn't work out. Actually, when you do Valsalva maneuver, ask the patient to do a Valsalva maneuver, you can see there's an increase in, you can see there will be a intermittent proptosis. Previously you will see that the eyes are a little bit anathalamic, but when you do a Valsalva maneuver, this kind of patients can present with intermittent proptosis. And interestingly, in sometimes in MRI, in imaging also you can miss, but when you ask the patient to do Valsalva maneuver, you can see the features in MRI itself. So what we can do is we can ask the patient to undergo an imaging and to confirm whether there is orbital venous malformation. And this tricky condition because right now there is no kind of definitive gold standard treatment. Basically, if there is if the patient is asymptomatic, people just observe it, but there are therapies like we have vascular intervention. Even they have tried with sclerotherapy, which they say has less recurrence compared to excision resection, because to do resection, this kind of condition is very difficult because it's a vascular malformation, and you cannot resect all the tissue. And when you resect also, it's very dangerous because it can cause bleeding, which can cause intraorbital hemorrhage, causing blindness. But this kind of patient can also present with, if you don't do anything, can kind of present with acute hemorrhage in the orbit, which can cause blindness. So we have to be very careful, and it depends upon physician to physician whether to observe or to intervene. So in this patient, she was complaining of pain, so I have asked her to undergo MRI. So we'll see what's the extension of the orbital varices in her. Thank you.